Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. A microbiologist immunologist at Upstate focuses her research on the onset and progression of autoimmune diseases such as lupus, and she is my guest today. Dr. Iwona Koenig is an assistant professor of microbiology and immunology at Upstate. Welcome to the Informed Patient, Dr. Koenig.
Thank you for having me here today, Amber.
Now, listeners may not realize that Upstate has the Lupus and Autoimmune Center of Excellence where patients would receive medical care, but then you're doing research that focuses on this particular autoimmune disease. Can we start by having you describe what lupus is?
Of course, Amber. Lupus is a chronic autoimmune disease. That means that immune system, which normally protects us from infections, and whatever happens during injury, becomes confused and starts attacking the body's own tissue. Lupus can affect many parts of the body, including the joints, skin, kidneys, heart, lungs, blood, and sometimes even brain. So one of the reasons lupus can be so challenging is that it looks different in different people, depending on the background and genetic considerations.
Who does it affect?
Lupus can affect actually anyone, but it's much more common in women, especially in childbearing times. It also affects some racial and ethnic groups more often and more severely, including Black, Hispanic, or Latino, as well as Asian and American Indian. But with age, lupus actually can as well occur in men, so it doesn't exclude anyone, but it has a predominance depending on the hormones to women during childbearing years.
And you described how it can affect so many body parts. Are there specific symptoms to be on the lookout for that would signal lupus?
It's a fantastic question, and that's what is really confusing because the symptoms can vary a lot from person to person. Some of the most common symptoms are extreme fatigue, joint pain and swelling, skin rashes, specifically the skin rash, which is described for the lupus, is the so-called butterfly skin rash in the face when you look like you have a butterfly on your face from the inflammation of the skin. But you can also have fever, hair loss, mouth sores. And what is actually interesting, most of the lupus patients going to have sensitivity to sunlight. But in some people, lupus actually can affect internal organs without any of those symptoms, such as kidneys or heart. So it really depends where you are, what you're exposed to, and what your genomic milieu is.
How is it diagnosed then?
As you can imagine, because there are so many symptoms, there is not a single test by itself that proves a person has lupus. Doctors usually make the diagnosis by looking by the whole picture, symptoms, times, even in a history, what happened in your child, physical exam, blood test, urine test, and sometimes imaging or biopsy, especially the kidneys are involved. It is often like putting together pieces of a puzzle. So in order to be diagnosed with lupus, you have to meet at least several criteria out of more than 10 different specialized symptoms which can occur in a lupus patient.
How debilitating can lupus be?
I'm not a doctor, I'm a researcher, but I do love to interact with lupus patients and make them aware of the research and how the research is done. So from my experience, for some people, it's relatively mild and comes and goes in flares. For others, can be very serious from the beginning and affect major organs like kidney and brain. Complication can include as well a complete systemic inflammation in the body, like you would have a really, really bad viral infection, or cardiovascular disease, lung problems, blood clots, and as well problems involving other and identified, in many cases, parts of the body. That is why we think that very early diagnosis and awareness of autoimmune diseases and careful follow-up are so important.
Can it be cured?
That's my dream, to be cured, but at this time, lupus cannot be cured, but it can often be managed much better than in the past. Many patients can live full lives with the right care, monitoring, and treatment. And there is a lot of new therapies, very exciting therapies on the horizon, which are currently being tested.
When you talk about therapies, is this medication or what is done typically for treatment?
It really depends on the person, as with everything in lupus, because this is such a diverse and complicated disease. And treatment depends on the person, on which parts of the body are affected. It might include medications to reduce just inflammation and calm the immune system, so the immune system doesn't think anything bad is going on. In more complicated cases, people can require to give a break to the organs, like, for example, my kidney, and have dialysis. The goal is to help patients feel better, reduce damage, and improve the quality of life. The most recent and most exciting treatments involve so-called CAR T cell therapies, which try to target specific immune cells and treat them. So there is no need, no activations of those cells in a stress situation.
So CAR T cell therapy, that's sort of on the horizon, or is it being used in some patients these days?
So it is on the horizon and it's used in the clinical trials. The outcomes, although on a very limited number of patients, I have the luck to collaborate with Dr. Roberto Cariccio from University of Massachusetts, who had one beautiful example of full recovery. We don't know what is full recovery, as this is, transient. We don't know if the disease will not come, but a very deliberating case of lupus. It's very interesting because one of the most difficult symptoms the patients deal with, which is kind of a symptom which not everyone is taking seriously, is the severe fatigue. It's one of the symptoms each therapies are showing are actually a huge improvement besides, the improvement of immune system, of things which we do not really feel per se, but the fatigue which really defines how we live everyday life seem to be improved, which is really fascinating and promising.
Now, do we know what causes lupus?
We do not think lupus has only one single cause, and it will be different in different people. It's more likely that lupus develops from a combination of genetics, hormones, and environmental triggers. In other words, some people may be more prone to it, and then certain outside factors may help push the immune system in the wrong direction. Like, for example, we know environmental exposure, whether it's going to be a pollution or smoking or UV irradiation, can trigger lupus symptoms.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with microbiologist and immunologist Iwona Koenig about her lupus research. So please tell us how you got interested in studying lupus.
I became interested in lupus because it's a disease where the immune system loses its balance and predominantly affect women. Actually, most of the autoimmune diseases affect women, and I am a woman. And I had a disease which no one could actually identify what it was, what it made me feel not well. And that's how, from being a chemist and biophysicist, I became immunologist. And I find both scientifically fascinating and very important, as it connects me as a basic researcher to patients. And I'm specifically drawn to the question of why the immune system in lupus can remain switched on, even there is no obvious infection present, as most of the pathways which are switched on are usually related to activation during viral infections or bacterial infections.
So, talk to me more about the role that the body's immune system plays in lupus.
Yes, absolutely. We think autoimmune diseases start from the dysfunction of immune system. The immune system is central not only to lupus, but other autoimmune diseases like rheumatoid arthritis, MS, or other autoimmune diseases. So normally our immune system can tell the difference between the body's own tissue and something foreign, like for example, a virus, a bacteria, or some foreign body like pollution out of smoking cigarettes or, environmental pollution because of industrial pollution. In lupus, that distinction starts to break down. So the immune system reacts to the body itself and starts causing inflammation. Once the inflammation starts, it can affect one or another organ. In lupus, we know that it can affect all of the organs at once or one in particular strong.
Are there triggers that make the immune system react?
As I already mentioned, lupus disease can be accelerated to environmental exposure and whether you have genetic predisposition or not. So in a way, it is not much different to a cancer when people say you are sometimes at the wrong time in the wrong place, exposed to something what is not really correlating with your body. And once this makes your immune system completely out of order, it is very difficult to bring it back. So in sunlight or ultraviolet light exposure, smoking, or actually even certain medications in some people, they can actually trigger lupus-like symptoms. And in a person who is already susceptible, or in a person who normally would not be susceptible, but it was exposed for such a long time and such a high dose that it becomes looking like lupus-like disease.
You were initially investigating whether certain viruses could prompt the development of lupus. Is that right?
Correct. Yes, I was actually first interested how our cells, when they get infected, can recognize what is the viral material and what is our own human material. What is the difference? And I was interested from the biophysical point of how these molecules are built and how different they are and what viruses or bacteria try to do to make themselves look like our own parts of body to evade our responses.
Can you tell us how your research on this has shifted?
At first, I was really interested in chemical bonds, thermodynamics, and all these little details. But after moving to US, I realized that one cannot do a research in a vacuum and has to put this in a context of a disease. And I found that lupus is one of those diseases which, in my interest in biochemistry and biophysics, can be actually placed in and answered in a different parts of the body. So I can not only answer the question why and how, but how this will be happening in the heart and how this will be happening in the kidney. So I was trying to find the patterns, and that's how I moved into the lupus. Right now, we not only are interested in viruses or bacteria or other microbes, but as well as in the environmental exposure like UV exposure, which actually can trigger the same pathways or mimic to be like a virus in our cells. We also study whether leftover pieces of viruses, when there is no more active infection, we cannot detect the virus by any test as we do it at home, including SARS-CoV-2 or Coxsackie viruses. Some of those pieces of viruses can linger because they are built in such a way that our cells cannot destroy it. and that they can signal this danger for quite some time after the infection itself is gone. And that might be one way the immune system gets stuck in an overactive state. Also, as a basic researcher, I have to collaborate with physicians, like, for example, Dr. Pearl, who has established Lupus Research Institute here at Upstate. And I collaborate not only with rheumatologists, but as well with pathologists, like, for example, Dr. Paul Shanley, who is a kidney pathologist here at Upstate, and as well with collaborators outside of Upstate, like, for example, Dr. Deepak Rao at Harvard and the US network of researchers he coordinates, because to really understand the mechanism in such a complicated disease and eventually design better treatments, we need to study them in many, many patients.
I'd like to ask you about oxidative stress. How does that affect our immune systems, and might that have something to do with lupus?
Of course, oxidative stress, it's kind of, let's call it a stress in principle, whether it's gonna involve oxygen or not, because being stressed mentally can actually increase the levels of activated oxygen molecules in our body and induce oxidative stress. It doesn't have to be a toxin, a virus, UV irradiation, a pollution. It can be sometimes even the simple stress which we are exposed from the everyday life or situation we are placed in. But what oxidative stress does is it builds up to many highly reactive molecules. And in small amounts, those molecules are normal and sometimes actually help the cell to live. But if they build up too much, they can damage parts of the cells and change how the cell behaves. You can think about this as the cell is being pushed into an unhealthy state. Oxidative stress is widely recognized as being extremely relevant to lupus biology. And actually, one of the first people who recognized that oxidative stress and antioxidant drugs are important in lupus therapy is no one different than Dr. Pearl, our chief of the rheumatology clinic here at Upstate.
What do you hope to accomplish with your research?
What I try to accomplish with my research. Of course, as a researcher, I want to know how it works. But immediately after, when you know how it works, you want to know how you can change the way it works to profit the patient out and as well allow the cell to recover and continue supporting our life as long as possible.
Would you envision an eventual treatment for lupus being like a vaccine that might prevent it from developing, or medications that would manage it rather than, because we talked about how depending on which body system is affected kind of dictates the treatment. But would there ever be something that would just treat lupus in general and it would impact all of the body systems?
That would be a dream, but personally, and this is my personal opinion, I do not think this will be a case. We are going more in the road as with the cancer treatment in more personalized therapies. Broad types medication might be good for one person, but it will not be good for another person. It has a completely different genetic susceptibility, may actually make things worse. That's why most of the clinical trials for lupus at first were not really working, because we were not paying attention to the diversity of those lupus diseases. It is not a one disease. It's a disease of many, many different little things coming together. So as with a vaccine, let's say you are going after one virus. In lupus, you have many, many viruses or many, many different exposure type of things. And As of now, whether the vaccine gonna be targeted to one cell type, I don't know, but I cannot imagine at this point of research. I wished it would be a case, it would be easy peasy, as we say it, but it is actually really complicated.
It sounds like it. Well, I appreciate you making time to tell us about your work, Dr. Koenig.
Thank you so much for having me. I am a huge advocate for connecting patients with research. I think this is very important to build the trust between the research and particular type of disease community. And if I can give one extra shout out, May is the month where we really talk about lupus and lupus related diseases. And we are lucky here in Upstate to have Lupus and Allied Disease Association, which supports not only lupus research, but as well different events connecting lupus research with patients. And on Saturday, May 9th, in Utica will be our yearly lupus walk, where we can connect directly researchers with the lupus patients. A beautiful purple color type walk, and we are hoping for the best weather possible. Not too much sun, though, for the UV exposure.
My guest has been Dr. Iwona Koenig, an assistant professor of microbiology and immunology at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.